Okay, you're receiving this video because you've expressed interest in coming to our office for Botox or fillers. So, question is, have you had these done before? Is this something new for you? Or are you just looking for a new place that feels like home? So, I'm Dr. Knies. I'm the on-site physician. I am an MD and founder for Rose Injectables. And the reason I'm here to share with you today is because there's something different that happens in our office that doesn't happen in other places. When you're preparing to come to our office for the first time for a treatment, I just want to walk you through a few of those specific things for something like Botox or fillers. So, small little tidbit on these just to help you differentiate, because sometimes people don't know exactly what the difference is of the two. So an easy way to think of this, and this is not fully how it is across the board, but some people like to think of Botox being kind of from here up and fillers from here down. When you think of fillers, they're truly filling in a space to soften it. They're using hyaluronic acid. That's what your body already makes, but we lose it over time. So we're going to take a gel form of a hyaluronic acid and strategically place it in different areas to create a little bit of lift or fullness. But at the end of the day, you should never look fake. You shouldn't look overdone. You should just look more rested and just like you, but maybe a couple years back. Next, when we talk about Botox, that's just going to address active muscle motion. So that's the whole mechanism of Botox. You shouldn't not look like yourself, but you should just be yourself without some of those harsher lines or things that make us feel older than our stated age or older than we feel inside. So you're going to come into the office on your first visit. It's amazing if you can come without any makeup or skincare products. The reason for that is we want to get your baseline start photos with our Visius skin analysis device. This device is intended to compare you to thousands of other women your age and produce a baseline score, including a true skin age, so that we can properly map your progress over time. Over the years, one of the coolest things I get to do every day is tell women how many years they aged backwards. Legitimately, it's like fountain of youth. We can age you backwards, but we have to have a baseline to start with first, and that requires accurate, clean photos to start with. By applying skincare or other treatments to your skin, sometimes there is a shine and a reflection off of the skin with a camera, and so it cannot always produce reproducible results or accurate results. So we ask that you not have anything on your skin. If you do, that's okay. Just let us know and we'll make a note, but please be sure that the next time that you come in or before any other big sort of treatment, if you decide to try Morpheus 8 for collagen building or 𝗁𝗏𝗃 for sunspots or dark spots, things like that, that we make sure you have a very clean palette before we start those, even if you took pictures previously. So you come in, we're gonna get your photos, we're gonna get a questionnaire. We wanna know whatever it is going on with you. If you've got special needs, things that are on your mind, we wanna take the time to know what you see and what is most important to you. At the end of the day, if you have a list of 10 things important to you and number one has been on your mind for years and we don't address and take care of that, we haven't listened. Our whole goal is to listen and treat the things that are important to you. Sometimes that means we say no. Sometimes a treatment, you want something, but maybe you want to save up for it. We're happy to say, let's set a plan and make a goal and get you exactly what you want. In my mind, I don't have any problem with you taking time to make those decisions, but I can tell you it's a personal decision. And we are not here to influence that, just to provide that education and knowledge for you to make a well-informed decision. So if you decide on the day of your consult that you do want to proceed and get Botox, beautiful. A lot of times we can do it same day. We set aside typically up to an hour of a free initial evaluation for you when you're coming in, just to get to know the staff, feel comfortable, walk through the process and procedures, things like that. So if you decide to proceed, what we're going to do next is we're going to map you out. I've heard this is sometimes a unique thing that not everybody has experienced before, but what that means is we're going to take pictures of you making various faces. So when you're coming in for that treatment, we're going to do the mapping. We're going to take photos of you, and that requires us to get a facial expression without any expression at all, just at a rested state. Then I'm going to have you frown down like you're angry, push your eyebrows together, raise your eyebrows like you're surprised, and then squint and smile at the same time. Honestly, most people have to practice in the car to do that one before they come in, because trying to coordinate all of it doesn't feel as natural at the time. Then if there's other things that you're interested in treating, like lines around the mouth, masseters, or those TMJs, the depressor angularis, or that chin mentalis muscle that as over time starts to lift and get stronger and create a strong crease in the skin, we'll have you make those faces too. So pulling down, clenching, and all of that so we can evaluate it. If we get into the next space and we're wanting to treat those platysmal bands, we'll have you extend so that we can see and evaluate those as well and have photos. These are important because anybody new to us, or if we're doing a new or different treatment, we will schedule to see you back in 2 weeks. That's all included in this because we want to make sure that we understand you, see how you respond, and we can make quick adjustments if we need to. We've been doing this nearly 3 decades. So there's not a whole lot we haven't seen, and it's pretty hard to mess these ones up with all of the years that we've been doing this. But the reason why is because we've checked our work over and over again, and we have that opportunity to look at this and see, hey, is this a little bit of an outlier? Do we need to adjust something? Or maybe we went into this a little bit more cautiously because of a specific situation you had in the past where maybe a brow was heavier, or maybe your lips were too full or whatever. And so we can have this treatment perfect for you. So you're mapped, you're marked out, we've got photos, we can go ahead and proceed with the treatment. As long as you're in agreement and you say, yes, that's what I want to treat, these are the areas I want to do, wonderful. The information is for you. We will map everything out and provide it to you, and you can then tell us, this is what I would like to do today. We can then also present you with opportunities if you wanted to engage in a membership program. Our memberships came from our clients. They asked for ways to just pay each month instead of all at once when they come in, so that essentially they can pop in really quick, sometimes just on a lunch break, get their treatment and head out the door back to work, and they don't even have to stop at the register to take care of payment. And then we just keep you on a schedule. We have you booked every 3 months coming in if it's for Botox, so it works beautifully. And we have different options for you based on your needs. And we have various ones that also include monthly or every quarter doing a chemical peel, IV fluids for hydration status to make that skin glow better. Maybe you stay chronically dehydrated, or you've got some dullness in the skin, we want to brighten up some too. Also, if you're using skincare, I mean, honestly, we all are, right? It just depends on that quality of it. But sometimes it's not always the quality, or maybe we want good quality to go further, but that chemical peel may be the key to that too. So that's where the memberships are neat, where we can really look at more of those pictures as well. Okay, so we have taken care of your treatment. So we want to understand what it's going to look like afterwards. So when you have Botox completed, typically it's going to look like mosquito bites on the face if you have any reaction at all, and typically that's 30 minutes. There's still some people are going to be higher risk for bruising, and sometimes we have a lot of vessels around the crow's feet or maybe on the forehead that we can see. Sometimes we can't see them, so there's always a risk of bruising, which we try to avoid, but it's possible. If for some reason you have an unwanted bruise that does appear, we can actually bring you in a day or two later and treat that area with an IPL laser on specific settings to help that reabsorb faster. So we don't want you walking around trying to cover this up. Just let us know, let's get you in and get it taken care of. And we love to offer that to you. And we don't charge if we need to just treat a quick bruise in an area, because we want you to have the best results you can. Botox typically takes 2 weeks to fully kick in. Some people start to notice some changes at 3 to 5 days progressively, and then at 10 to 14 days, it's fully active, so we can see those results. We'll bring you back in at 2 weeks. We'll check you with photos. We'll give those to you so you have them to take home and keep with you so that you'll see that progress over time. If you decide to go the route of fillers, say we're wanting to address some things down at that lower face, there may be some shadowing down here, some jowling. We want to sharpen at the jawline. We want to soften the nasolabial folds, or maybe we need to take a look at the structure and aging. As we're aging, we go from more oval shape to more rectangular shape. And with that can look a little bit heavier. And so sometimes the goal then is to come back and create this beautiful oval shape to the face so that we can have that youth restored to the appearance. So that sometimes involves adding a little bit of filler to add in space to the temples and sometimes to the cheeks. So if you find yourself going around saying, I really want this, then sometimes that means we want to do cheeks and maybe not start down here. So we always start higher and come down lower to address those areas. With filler, some places do receive numbing. If we're going to work on those lips, just to restore as we age, the sides of the lips start to turn in and our Cupid's bow starts to flatten. So we can come in and just lightly turn those lips out to restore that volume we had 10 or 20 years ago and restore that beautiful Cupid's bow to create that definition, or even on that vermilion border. But please keep in mind, we're always watching your anatomy, your fullness, and what is anatomically appropriate so that you always look like you. We use something called the Ricketts-E line, where we're looking at the structure of the face on that profile, and we're looking at that extension of those lips to make sure that we do not extend you. We do not do duck lips in our office. So we're always very cautious to make sure that we keep you optimized with beautiful lips that are not overdone. If we're doing lips, we like to do a dental block. We find that topical numbing, while it's a beautiful thing for a lot of stuff, lips are very sensitive and it can take a lot more time than most people have to do that topical numbing. So we proceed straight to a dental block. We are experts at this, been doing it many decades, and can quickly numb you, do your treatment, and then that wears off fairly quickly after you're completed the procedure so you can go about your day. If you have never had fillers before, I usually tell everyone, just count on maybe 3 days afterwards that you just always catch yourself in the mirror and you're seeing, and maybe there's a little bit of swelling and stuff like that. But that calms down as everything integrates into the tissue and should give us just a beautiful result in the areas that we're wanting to treat. When we are doing these treatments, there are times where strategically we need to put more product in an area to create the change we want. say that over time you feel like you're getting drooping at the corners of the mouth, and we want to sort of turn that smile up and create that lift. Sometimes that product required, you might feel a little bit of fullness, but at the end of the day, you should never visibly be able to see bumps or lumps. Those are things that should integrate in, and either we will do that or we will evaluate it. And sometimes it's just swelling. So just let us know if you notice that, because that is not the endpoint that we desire, and that needs to be corrected if it is in fact filler producing it and not something like swelling temporarily in the healing process. Have had your treatment done, we've done your 2-week recheck. We usually just instruct you on that timeline for you. So Botox typically lasts about 3 to 4 months. Most of our patients on membership are scheduling right at 3 months. And for fillers, depending on the area, usually between 1 and 2 years. If you're at an area where you're being treated that has a lot of movement, think facial expressions, smiling, things like that, it's more likely that's going to last closer to 1 year. And when you're looking at areas like cheeks and other areas that don't have that dynamic movement as much, you're looking closer to 2 years. So it's a great way to plan and know, hey, these are going to last. They're going to create amazing results, create this natural effect that just makes me look and feel more confident, like I can go out and have this youthful expression and conquer the world. That's the goal, right?